But give us the latest on Miami.
Yeah, Mika, as you mentioned, Miami now the new epicenter of this pandemic. Florida had its second worst day for new infections yesterday, adding well over 12,000 cases just a day, you'll remember, after shattering the record for the highest number of single-day cases of any state since the beginning of this. Miami-Dade County was responsible for a quarter of yesterday's new cases and represents about 20% of the total number of infections statewide. Health advisors to Miami-Dade's mayor described the situation as extremely grave. The mayor is resisting pressure to close more businesses despite having more infections and hospitalizations compared to March, when he ordered all non-essential businesses to close. Mika.
An infectious disease specialist at the University of Miami said the situation is like what was happening in Wuhan, in China 5 or 6 months ago, and like New York 3 months ago. Remember that? Florida state lawmakers are calling on the federal government to coordinate with state and local leaders. 98% of ICU beds in Miami-Dade are occupied. In the past 14 days, hospitalizations rose 65%. ICU admissions are up 66%, and ventilator use is up 128%. The CEO of Memorial West Hospital in South Florida says, quote, "We are busting at the seams in the emergency room. I am busting at the seams inside the hospital. I'm busting at the seams in terms of ICUs." The biggest challenge, she said, is staffing. One doctor telling a local investigative reporter, quote, "We are really burned out." Let's bring in the president and CEO of Jackson Health System in Miami-Dade, Carlos Migoya. Dr. Migoya, thank you so much for being on the show this morning, given everything that you're going through. But if you could tell us the very latest there and what is needed.
Obviously, the number one thing is every hospital is fairly full, and what we're managing right now is really maintaining the census that we have, and as non-COVID patients and some COVID patients discharged, we're replacing them with COVID patients. We have seen a great increase of admissions. We are also doing a great job of discharging. The two challenges that we have right now, number one is making sure that our employees are all safe and kept without any kind of infection, which is extremely important. And the other thing is really about staffing. The governor has now released an opportunity for South Florida hospitals to be able to bring in about 2,500 nurses. That is critical to what we need. We have the beds, we need the staff, and that's the focus we're working on. In addition to that, the reagents for lab testing in our own labs has been extremely necessary, and the need for remdesivir. Those are the three big things that we need at this point.
The need for remdesivir. And if I could ask you about staffing at this point, do you need to bring in staffing from other hospital systems, other states? I know 3 months ago, Massachusetts lifted the ban, had actually new rules that allowed medical students to graduate and immediately start working. What's the situation in Florida in terms of staffing? How is it best fixed at this point?
The best fix right now is what we're trying to do. The governor's identified several different ways of bringing from out-of-state nurses in that 2,500 range that we're talking about in South Florida. And we believe that that will get us through the worst that we're looking at. We're looking at really, with everything that we've done right now with the curfew, the controls on the restaurants back again, and what the Mayor Jimenez has done here in Miami-Dade, we believe we got about a 3-week window before we hit the peak. And that is a very tough 3 weeks. We've already been going at it for full 4 months. And our staffs are very tired and very stressed and, of course, nervous.
Carlos, it's Willie Geist. Thanks for being on this morning. I want to ask you about the profile of the patients you're seeing. Early on, we were told March and April that it was mostly older people who contracted coronavirus. Then as this went on in the ensuing months, we heard about in places like Houston, younger and younger patients. What kind of a patient is in your hospital right now with coronavirus?
Well, we saw that influx of young patients as well, really, here in Miami. But what's happened right now with the growth, the number of young patients is still the same, but now we're seeing a lot of the older. What happens in Miami, because we have such group diversity here, is we have a lot of homes with multi-generational families within it. So the young people have come home and they've infected their mother or their grandmother, and that's actually made it a lot worse. And even the young people that we've seen, a high percentage of those young people have a lot of comorbidities, specifically in things like obesity diabetes, and lung issues.
So, Carlos, what is your message to healthy people in Miami-Dade, healthy people in South Florida and across the state of Florida right now? As you look at the scene inside your ICUs, what do you want them to know right now?
The only thing that will help us with what we're doing today is for them to use the mask and be socially distant. We're finding an awful lot of people that are extremely aggressive against complying to those environments that is really not understandable at all. So we need to make sure that everybody complies to those issues around keeping your hands clean, wearing the mask, and being socially distant. That's the only thing that's going to slow down this pandemic in South Florida at this point.
Carlos, if I could extend that question, if I understood you correctly, you said we are at least 3 weeks from the peak. We're also several weeks away from a lot of schools in Florida opening. They open mid-August, some of them. Is it safe for children to go back to school, given what you're seeing in your ICUs and emergency rooms?
Well, when you say Florida, that is a very large state. I can speak specifically to Miami. And in Miami, I know that our superintendent, as well as the Dade and Miami-Dade County, have not taken a very good view of opening the schools at this point in time. And if you look at today's environment, we're running a 25 to 28% positivity rate on all those patients that were being tested. We're testing a lot of people. We're doing now 4 to 5 times the number of tests we did 3 months ago. But those positivity rates of 25 to 28% are not indicative of us being able to open the schools here in Miami-Dade County.
President and CEO of Jackson Health System, Carlos Migoya, thank you. Best of luck to you. I hope you get those 3 things you need as you fight this pandemic.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.